Hello, my name is Alec Burnett. So today I'm just going to be walking you guys through a step-by-step plan for integrating medical family therapy into your guys' healthcare setting. Um, so I'm going to be looking at just how to include MedFT services into your organization as a whole through workflows and through training your staff and yeah, just overall improving it through medical family therapy. So by the end, you're going to have a little better idea of how it works. Really just little background on MedFT and just the evolution of it. So it's an approach that integrates family systems theory with behavioral health and medical care. Um, so it's the idea of this biopsychosocial spiritual model. So really that's just the idea that health is influenced by those factors, psychological, social, and spiritual. Um, MedFTs, they collaborate with medical professionals, patients, and their families um, to improve their well-being, support treatment, address any illnesses and trauma and conflict that comes with getting receiving healthcare. Um, just how like MedFT evolved and how came to be. So it kind of emerged in response to just the fragmented care between just the separation of like mental and physical health. It's always looked at as separate, but um, therapists and just research found that there's a need for that holistic patient-centered care, especially in primary care settings. Um, the idea or just treating it physically and mentally, it's just or when we weren't doing that, they were not able to have their emotional needs met, their relational needs met. Um, and this was just a way to really advocate for the whole person and address the whole person. So how we're going to implement this, it's going to be looked at through, it's based off of CJ Peaks. He's just a healthcare researcher and educator, but his three world view, and I know just based on research and my own research, I want to look at it through a four world view. So basically that is through the clinical, operational, financial, and training point of view. Training, the added one that he didn't have. Um, so really just I'm going to go over this in the next slides, but the clinical world's going to look at how delivering high quality care that meets patients' needs. You know, the operational world's going to look more of how the MedFT fits into the workflows and works as a team. Um, the financial world's going to look at the cost effectiveness behind it and what kind of MedFTs bring to the system and how their value is measured. And the training world, you know, is going to look at how MedFTs develop their skills and make sure it works well in healthcare. So for the clinical world, really the focus it's going to be on the patient and the care team and the results from that. In implementing this, we're going to be looking at making sure MedFT services are backed by the most current research and yeah, meet the standards for patients. And really, like I mentioned too, just MedFT, it's not just addressing the medical issue, but all the other factors behind that, the emotional, relational issues. And I'll include other examples throughout, but really you're looking at if like a patient's recovering from surgery, they also could have anxiety playing into that role. It's being able to MedFT being able to know how to provide interventions and work within that. The goal really for this is to ensure that it's efficient and high quality. And what will it accomplish? Will patients see improvements in their health? So being able to look at it that way. In the operational world, this is just involving how the plan is introduced into workflows, like I mentioned. So, you know, in a healthcare environment, very fast paced. So we want to make sure everything is seamless. So they participate in huddles, you know, meeting with other team members, conduct warm handoffs. Sure, I'll talk about more later, but really making sure that the care they're providing is um, able to relay to another professional and documented so that they know exactly what's going on so we can best provide that full holistic care. and that's documented by including in like a medical or electronic medical record system, just making sure it's all seamless and they know exactly what's going on. Um, and how success is measured, it's really by how it's efficient and how it's smooth and streamlined between other coworkers and other professionals. The questions we look at: how will it work? Is it efficient? Is this the best way to really just relay this information to other people, I guess. Looking at the financial side of it, so the financial world, we're just looking at how MedFTs and how the services are sustainable and how they deliver value to the healthcare system, and that we're making sure that we're using our resources well and smartly, and how we use those resources and kind of what outcomes they produce from that. Um, so for MedFTs, it's going to be value is shown by improving health outcomes, reducing complications, and really avoiding your um, healthcare system organization, and making sure that they're avoiding having to come in multiple times and that high cost care. Can be as simple as, and this is kind of all the medical professionals as a whole, but making sure patients get their preventative health screenings. Talk about like mammograms, tobacco use screenings, even depression screenings. Just the goal is to lead to earlier detection, so there's not as many expensive treatment later on. This is something that's really highlighted in like a HMO program, just that maintenance side of it. Really, the goal is to just, like I said, reduce those ER visits and those being readmitted. I think too, by just, let's say if there's a patient who has depression and they're having to follow some kind of plan, like the diabetes plan, detect it early, and this will just reduce complications. So the goal, and what we can do, like the questions we look at, is it a good value? And then are resources being used wisely? Are we doing everything we can to make sure that patients are getting the help they need before it becomes something even worse? Looking at the training world side of it, so our goal, or my goal just in this presentation for you guys too, in this part, is to provide, we're going to provide cross training for MedFTs and medical staff to build knowledge and teamwork, and strengthen teamwork really together, because want to make sure MedFTs have the skills to thrive in the healthcare setting. And really that collaborative, like I talked about before, even operations, just they're going to have MedFTs that are coming having the skills of a therapist, the humility, and knowing what intervention to go with and approach. But really making sure that it's all collaborative, so we're all in the same care plan and other providers know what's going on. Really, it's about making sure that they're prepared for all the different specialties in healthcare that they'll be working in. They could be working in multiple different departments and whatnot. So we got to make sure cross training happens. So, for example, like if a MedFT really like understanding how a nurse works, their workflow, or like primary care physician, so knowing how it all works together, so they're not coming in not knowing how the plan goes. So having a knowledge of what everybody does, basically. And some questions to look at, like what skills are needed, and is training really effective? Is it practical? That's what we're shooting for. Looking at different screening, or excuse me, for screening protocols. So these are some of the tools to identify patients who might, benefit from different resources and services. They're going to look at the psychosocial and relational factors involved with the patient. So as I've included on here, common tools that are used. These tools are a lot of times are used in like an intake process, even for like a normal therapy appointment, or just like a routine medical visit, like with your primary care doctor. Um, this is something that if a screen is positive, meaning that they fit criteria for some kind of you know illness or struggles that they're having, basically based on the screening protocols, we'll know what to do. And I've included, yes, some of them for depression, anxiety, alcohol use, trauma history, and just a social needs screening. So these are just some examples of some different screening protocols that are going to be used. And so the workflow when a patient, screens positive, um, for example, for any of the ones I mentioned, like depression, um, the providers get to review the results, and they may initiate that warm handoff to the MedFT if it's something where like the doctor looks over at it. Um, this means the provider's gonna, at that time, it'd be able to introduce it like in real time, very quickly. They know exactly what to do. From there, the MedFT can conduct a consult, like usually 10 to 30 minutes to explore the factors that might be affecting their health. Um, and just all the factors that a therapist has to know to look for. Um, especially in healthcare, what's the family support look like, the stress of caregiving, and all cultural beliefs, everything that we have to look at. Um, and then the MedFT2 is just going to work with the patient and provider to develop a care plan and to see how to best serve them. Honestly, just and the last bullet point on there too, just want to reiterate um, how they're going to document in electronic health records, so everything is known and documented. Document. For behavioral health interventions, so doing my own research, I want to primarily use solution-focused brief therapy. So this therapy, it's short-term, it's goal-oriented, and it's strength-based. And I think those things align well in a healthcare setting. It's fast-paced, and I think what SFBT does well. It focuses on what's working, not what's wrong. So, and this can be ideal for helping out patients, really empowering them dealing with medical issues. I think it's a great way to use it. Kind of just how it's different, working with individuals. You can help the patient set realistic goals. What will be better when your pain is more manageable? Questions like that. Using scaling questions to track down symptoms, scaling questions simple 1 to 10. How are your symptoms and how are you dealing with this, basically. For families, we're going to look at just improving communication during care transitions or treatment decisions, really just keeping more of the family involved, working together with them, trying to, reframe their strengths and just highlight their resilience during the illness. Like, how have you supported each other through this and even through like past challenges to really, empower them that if they've done this before, they have the strength to do it now. Other techniques, ask miracle questions, looking at like if you didn't have this illness or struggles, what would it look like? Like if you woke up one day you didn't have it, how'd you act and how would you feel? And really just using those kind of techniques, identify exceptions to develop a clear path. A question: what's one small thing you can do this week that would help you feel more in control of your health? And just for adapting to different social location factors. So when using this therapy, we have to adapt to their social location. Using culturally relevant language when talking about goals, so patients feel seen, and really just adjusting the questions using their language. So taking into account, really hearing their story. Okay, how does their transportation, have transportation challenges? How does caregiving play a role in this? Really, just making sure to ask questions not from one point of view. Consider some cultures, highlight individual like achievements and just kind of point of view, and other are more collective. Just remaining mindful to just remain mindful of that. And there's different power imbalances within healthcare, making sure that we're listening to their voice and amplifying their voice, really. This can be, for all walks of life, but really just for, or, looking for the LGBTQ plus community, like immigrant community, making sure that they're like more marginalized communities, that they feel relevant and that we're understanding where they're coming from. For just looking at individual versus family treatment planning, so we're going to tailor plans differently for individuals and families. When working with the individual, the treatment plan is going to focus more on personal symptoms and how they affect their behavior. Example, even like how anxiety plays a factor in someone's plan. The MedFT is gonna, help set those goals and come up with a plan. With the family, it's gonna shift a little bit where, you're going to kind of like I mentioned earlier, include more of the relationships and the patterns from the family that are influencing them. Like, for example, if someone's struggling, like if a child's like struggling with like asthma, like what's the family's stress and routines going to look at, and communication, how does that affect everything? The MedFT will bring the family together to strengthen their support and, just see how conflict is, handled with them. Yeah, so just in conclusion, medical family therapy really, it really connects like the medical side with the physical side of healthcare and really looks at patients' overall needs. I think success comes when we integrate this four worldview that I mentioned, and implement it across the clinical, operational, financial, and training worlds. Those four, it's going to really, make it a patient-centered care, and it's really, MedFT and just medical family therapy. It's really integrated and transformative healthcare. I think it'd be great in your guys' healthcare system. I've included some references if you wanted to do your own research as well from this. Thank you.